Howdy, folks. It's September 2nd, Tuesday. The last update I gave you regarding my health was pretty gloomy and dark. I was all but convinced that I had significant metastases or metastatic disease that had spread to my lungs and a spot to my liver. I was on my way to MD Anderson, which I went last week to MD Anderson in Houston, where they laid me face down on a table and slid me into a CT scan and put a mark on my back with a marker, and then inserted a giant needle that went in between my ribs and all the way into my lung, where they took multiple biopsies looking to confirm cancer. It would have been colon cancer, not lung cancer, that had spread as metastatic disease. When I talked to my doctor the following Monday here in Tucson, my oncologist, he was very somber and talked mostly about the aggressive treatment that he was going to prescribe, and wasn't very hopeful. He honestly wasn't encouraging or hopeful at all. Not that he's a bad doctor or that he has bad bedside manner, but that's just how he is. And I think he was trying to keep from giving me any sort of false hope. And so I have been in a dark place, lower than I've ever been. There's a great word called nadir, which means the lowest of the low, the lowest point in someone's life or in some process, and that's where I've been emotionally and psychologically as I've been preparing myself for chemotherapy and possible surgery, but I had very little hope that I would survive stage 4 diagnosis or restaging. So all that being said, I got a call today from Dr. Scott here in Tucson, and he had the results of my biopsies from MD Anderson. And when I was at Dr. Scott the Monday before, during the follow-up that I just mentioned, he retested my Signatera, and today he called to tell me that the biopsies, multiple biopsies, all came back negative for metastatic disease. And he said that my Signatera, after 6 months, is now negative or 0. And I'm essentially speechless. I don't have the words to describe how I feel. I'm cautiously optimistic. I know that cancer can be a sneaky disease, and it can hide and lie dormant for years. But I take I take the news as encouraging. I am encouraged by the fact that my Signatera had been trending down for 4 months, and or for longer than that, essentially 4 months, and the fact that it finally hit zero is very encouraging, because there are false negatives, but I don't think that that's what is going on here. And the fact that the biopsy confirmed that there was no metastatic disease in the largest nodule that had grown 5 millimeters in the last 3 months is also highly encouraging. So that being said, tomorrow I have my follow-up with Dr. Morelli from MD Anderson. I'm very eager to hear what she has to say about all of this. I don't even know if I'll be I don't even know if I'll qualify for one of those trials. I don't even know that I'll need one. That I'll need to even apply for one at this point. But I do want to hear what she has to say, because she's very knowledgeable and seems to really want to do what's in my best interest, and if it's possible that Signatera can come back positive again, I think she's going to recommend that I participate in one of those 2 trials that I mentioned several weeks ago. I'm also, according to Dr. Scott's office, I need to come in tomorrow, which I am tomorrow afternoon, and I'm going to be tested for multiple lung infections, one of which is valley fever, which is something that ChatGPT had actually mentioned that could be the cause of the growth of those nodules, and also the presence of all of those new smaller nodules that really scared the you-know-what out of me. Again, I don't have the words. I am so grateful to the universe. I was just talking yesterday to my cousin Tim about how I feel like God or the universe, or I tend to try and avoid placing a label on something that can't be labeled, that can't even be described or comprehended fully by the human mind. But for today's purposes, I'm going to say God or the universe. I was telling my cousin Tim yesterday that I feel like that God doesn't intervene in our lives in the way that we think, or we would hope that it does. And when people pray for me or pray for themselves, I said I don't think that God is moving in our lives in that way. And then I told him that as soon as I say things like that, the universe or God has a tendency to tap me on the shoulder and do something, or bring to my attention something that I know is for certain an act of its will. And this is one of those things where I don't have the words to describe how fortunate I am, how grateful I am. I just know that this is the universe moving in my life, and and helping me in a profound way. Again, I don't have the words. I can't even grasp how this has all fallen into place the way it has. But I know I'm doing a lot of mumbling, and I'm not being as concise with my words. I'm not being as eloquent as I had hoped to be with this update, but I love you all. I am hoping to be around for many years to come. I'll let you know what we find out with this with these tests that I'm taking tomorrow. If I have valley fever or what it is, some sort of lung infection. I'm still not out of the woods. No cancer patient is until the 5-year mark. So I still will be under maintenance or surveillance, having my blood tested, and having colonoscopies and CT and PET scans on a regular basis. But for right now, I'm just going to take this win and just be grateful, and let you know, communicate to you all that I love you, and that I could not be where I am today without the support and love and prayers of all of you. So here's to you, and I appreciate you and all that you've done for me and your support. And I will be back with another update as soon as possible. Okay, I love you, and I'll talk to you soon. Bye.